Um, and this is our second live session where I discuss most commonly asked questions. And we changed the format a little bit now to have, instead of people asking questions before, actually what we do, we go into different chats, support groups, and check different categories of questions, and especially the responses. Okay, why it is important? Because there's so proliferation of different support groups on the internet, and so-called hair loss specialist, usually it's defined as a self-proclaimed hair loss specialist giving different advices. It could actually harm people. Okay, what is important to understand with the hair loss? Hair loss is the same condition, chronic condition, like diabetes, like hypertension. Hair loss can be caused by a variety of different causes. The most common that we talk about, of course, is androgenetic alopecia, but there are a lot of other what we call unpatented alopecia that we have to be aware, because this is will make the most difference when we decide what type of therapy is to choose. So with that being said, it's something that we were planning for a long time. It's not going to be perfect from the first time, and I'm going to try to evolve and get better as we go. But I think the topic is important to be covered, because again, there's a lot of information being posted online that not necessarily correlates with the reality. A lot of that has a commercial bias. Companies, individuals are trying to take advantage of people in with problem with hair loss, and who looking having an emotional distress, and they trying to find the best solution to address their problem, and unfortunately fall into these traps set by different companies using social media. All right, so let's get into some of the most common questions that we were able to obtain from inquiries on the forums. So let me just move the camera here. Okay. So the first one: so frustrated with my hair. It has been thinning since late 2019. I'm 42. It's not hormones. It's not thyroid related. My doctors thinks I have alopecia. By the way, when you say the word alopecia, what technically means it's absence of hair. So it's the symptom, it's not the disease. So when you say, someone says, it's just kind of common here, so I have alopecia. So literally it means I don't have hair, but we don't, it's again, it's a symptom. The disease could be different, right? So you can have alopecia due to a variety of different reasons. So I see a dermatologist next week. I've been 82 pounds since April 2022. I may not, so that not be helping things. I'm on biotin, collagen, and use a hair thickening shampoo. I do castor oil, rosemary oil, and wash it out with clarifying shampoo. What can I expect from a dermatologist who does steroid shots and does it help? Did it make you gain weight? Okay, so here's lots of different topics in this question. Okay, first, let's go one by one. So this patient, again, we're not going to disclose any details. So we know it's not thyroid related, okay, which is a good thing. abnormal thyroid function can cause hair loss. So when you go to a professional physician specializing in hair loss, like dermatology or hair transplant surgeons, they should look for causes other than androgenetic alopecia to make sure that everything is covered. So hypothyroidism, low thyroid function, can definitely have uh, uh, can have an ability to affect hair loss, right? So we need to start by checking TSH and the T3 and T4 hormonal levels. Okay, so the next thing, so this person is going to dermatologist, which is a good thing. Okay, it's a good beginning because dermatologists are trained to identify different conditions, and dermatologists is a good start because they can see whether it is a stress related, like telogen effluvium, or something hormonal, right, or some other conditions that can cause rapid hair loss. So before we say, oh, let's call a shot, we'll do the hair transplant, we want to make sure that there's other things that we need to address before moving into the operating room. Okay, so and this patient is on biotin, collagen, using hair thickening shampoo, and do castor oil, rosemary oil, and washing out with clarifying shampoo. Okay, so here's the things are evidence-based and not so on. Okay, so there is no evidence that castor, rosemary oil can do anything to the hair loss, treating it, except of causing some greasiness of the hair. Okay, so important to understand that everything that leaves the scalp, above the scalp, it's not a technically living structure. There is no blood flow to the shaft of the hair once it's out of the scalp, outside the skin. So all these things can hopefully provide some hydration, but as far as treating the cause of hair loss, we need to go below the skin, that where the hair follicle is, because that's where everything happens. Most of the diseases, they happen below the skin. There are three parts of the hair follicle, okay? And there are two that are important. One is called erector pili muscle attachment. That's all the bulge area of the hair follicle. And basically, this is the area what makes our hair shiver. So when we get cold, we get shivers, the hair is standing up, and that's what the erector pili muscle does. Okay, and that in this area there's a high concentration of what? Stem cells. And the second area is the bulb of the hair follicle, and that's where all the creation of the hair occurs. That's where the melanin producing cells are that gives us the color of the hair. So when we treat below the skin. Okay, so clarifying shampoo, I guess, is being used to remove rosemary and castor oil, which again, I think it's a waste of time as a physician. Okay, using hair thickening shampoo. I'm not sure how you can thicken the hair with a hair thickening shampoo, but again, this is not treatment of the hair loss. And collagen and biotin. Okay, so biotin, it's a good thing to have. It's the one of the vitamins that can help, but remember that vitamins are only effective when we have a deficiency. There's zero evidence that giving extra vitamin can help with anything unless you are deficient on this vitamin. So before you decide whether you want to take something, you can do the test, talk to your doctor, determine whether you're deficient on the vitamin. There are a lot of vitamins, right? And most of the time when we eating balanced diet, we should not be deficient in vitamins. Okay, it's not the time when people used to have scurvy because of the lack of vitamin C and so on. So now we are pretty, we are well educated and we eat right, and of course we should not have any vitamin deficiencies. So who does steroid shots and does it help? So again, the question is about the steroid shots. What's the cause of the hair loss? Unless it is known and a condition like LPP, lichen planopilaris, like other scarring alopecias, for example, frontofibrosis alopecia, alopecia areata, then the steroid shots will definitely help. But if it's others, of course not. So it's important to see a doctor to determine whether steroidal shots it's a good treatment option. And the next question, did it make you gain weight? So steroids in large doses can make you gain weight, okay? Will it happen with topical injections, not topical, intradermal injections in case of, let's say, alopecia areata? It's very unlikely, okay, because the doses are much smaller. We take steroids for other conditions like asthma, we have to give large doses of steroids, and of course it can affect weight much more than just those small intradermal injections. Second question. Okay, I hope I clarified some of the points. I started minoxidil 14 days ago, and now experiencing shedding. Is this normal? So, minoxidil is one of the most common medications used to prevent and treat hair loss. By the way, the side effect of having more hair for minoxidil was observed first when minoxidil was created as a treatment for high blood pressure, and then when they were given it to different patients, and they noticed that this helped with the hair loss. So this is how topical minoxidil came on the market. It was used for many years as a brand medication, Rogaine, and of course there's a lot of equivalents of minoxidil now on the market using topically. It's a well-studied medication, and minoxidil can cause shedding during first weeks of usage. It can vary between 2 weeks to 5 weeks. Usually it lasts 2 to 3 weeks and then slowly subsides. And then after a while, it starts working. So when you start using minoxidil, you should wait a few months. But shedding is totally normal. Did anyone manage to grow hair without minoxidil Rogaine? So here's another question, one of the forums. And I'm reading not only questions, but also responses of people to make sure that if some responding with nonsense, that we can recognize that. Okay, again, this is forum, so there's a freedom of speech, so anyone can say whatever they think. The question here is how reliable the source is. Okay. So I went to dermatologist. So another reply, I did experience alopecia areata for 1.5 years ago. I did a few things, and not sure what helped the most. I went to dermatologist and received injections. I was prescribed ketoconazole shampoo. I use that occasionally. I used to wash my hair daily, now 2-3 times a week. and reduce the heat of the water. I use Nutrafol, wasn't 100% consistent though. I started oiling my hair prior to washing. I tried to reduce my stress by working out more, doing yoga, controlling my thoughts. I can't point to any one thing because I did many, but I have no more bald spots. My hair is not where it was before, but it has improved drastically. Okay, so here's one of the replies. Is it possible to grow hair without minoxidil or Rogaine? So the question is, by itself, needs some clarification. Okay. Most of the time, when we talk about male or female pattern hair loss, we're not losing hair literally. What happens? The hair become miniaturized. The hair, let's say, we have one thick hair, and it becomes smaller and smaller and smaller. Why does it happen? Not because the hair is thinning, but because the hair is cycling. We have three distinctive phases of hair growth. The first phase called anagen, and this is the hair when it's growing and it's visible and it's thick. This anagen phase in the scalp hair should last between 4 to 6 years, sometimes a little bit longer. So people with a very thick hair, they have a longer anagen phase. So the longer the anagen phase, the thicker the hair. For example, our eyebrows anagen phase lasts only 3 months, and then the hair sheds. So that's why the hair should never get very long, right? Because the anagen phase is very short. So during anagen phase, hair is elongating, it's growing, it becomes thicker. Okay, so what happens with androgenetic alopecias? These anagen phases become shorter and shorter. So instead of 4 years of growing, it become 2 years. And within these 2 years, hair cannot grow long enough, doesn't have enough time to become thick enough. And it's become progressively over time, this anagen phase become progressively shorter. Telogen phase is the resting phase. And typically, as I said before, 4 to 6 years anagen phase, then 6 months plus minus telogen phase. With progressive miniaturization, what happens? These anagen phases, the growing active phase, become shorter. The telogen phase, which is a resting phase, become longer. So the hair progressively becomes shorter and thinner. And that's what happens. So when somebody asks, it was a very extensive answer, but when somebody asks, can I grow hair without minoxidil or Rogaine? You cannot really grow hair. Once it's gone, it's gone. But minoxidil and Rogaine, what it does, it can help over time to prolong the growing phase, the anagen phase, and to shorten the resting phase, the telogen phase. This is how medication works. That's why when you start the medication, you don't see results in the next 2 weeks, because it takes time to shift the balance between the growing phase and the resting phase. Okay? So here's a reply about I experienced alopecia areata for 1.5 years ago. So first of all, it's a different type of alopecia. Alopecia areata is completely different from male or female pattern alopecia. So when a person mentioned that reducing stress with alopecia areata using ketoconazole shampoo, exercising, Nutrafol, again, Nutrafol vitamins. You remember what I mentioned about vitamin deficiencies. working out, more or less stress, controlling my thoughts, it can definitely help with alopecia areata. One of the reasons we get patients with alopecia areata can get exacerbation, can get a flare up, is actually stress. It's a very well known, and we do need to, if you have diagnosed with alopecia areata, one thing is exercising, controlling your thoughts, as mentioned. It's absolutely correct what that person. But again, it was the response was, I assume, to someone with different type of alopecia. Okay, what is the next question? So talk about thoughts on Nutrafol. Is it an effective hair loss solution? Well, Nutrafol, unfortunately, as much as the company trying to promote, it might have some value, but nobody knows. There's no objective data until now that I've been seeing. If they're interested, they can send it to me. There are no in medicine we have such a way to evaluate whether something is working or not is by having seen it objectively, and objectively it has to be run through the studies called the double-blinded randomized trials, where you take, let's say, in Nutrafol on one end, and on the other hand is placebo, and then you assign it to two different groups of people. Not the researcher, not the person who takes the medication knows whether he or she takes Nutrafol or the placebo, and they have similar conditions, similar medical history, and we'll call it randomized, right? And then you, over years, you compare whether Nutrafol versus placebo is working better. That's the only way in medicine to actually have an objective data of something does work. So far, I haven't seen that about Nutrafol. So my comments would be, it may or may not for the company to prove by running randomized double-blinded study. This is the gold standard study. Okay, I hope it answers. All right. So female hair loss inquiry. The next question. And by the way, please don't hesitate to ask your questions. If you have any, I can see in the comments. I will respond to. Female hair loss inquiry. I'm currently experiencing hair loss like never before. I've been losing small amounts of hairline after I gave birth the first time. Figured it was just postpartum hair loss, which it really was. Then on my second child, I gained a lot of weight. Right now I lost 44 pounds, but also lost 70% of my hair. I'm wondering how manage it to stop hair falling out. There are growths, but even those baby hairs easily fall out. I have been taking collagen and biotin and other supplements, but it's still thinning day by day. So the way it is described, it's likely a stress-related type of hair loss. And likely due to a recent childbirth, increased stress, hormone production can definitely cause stress related hair loss. Additionally, we call it telogen effluvium. It is usually resolved by itself once the stressor factors are removed, and gets better over time. This person taking collagen and biotin, again, I don't know where the collagen came into the treatment of hair loss, but in other supplements. Biotin, same response as I said. Unless you are deficient in biotin, there is no reason to do it. Okay, it's not gonna by increasing levels, it's not going to provide more protection against hair loss. But what I would recommend is to see dermatologist or hair loss physician to be evaluated. One thing that we can do is to have a microscope. Can we bring the microscope here? Thank you. All right. So when I see my patients, they undergo trichoscopy microanalysis. So there's something like this, and it can show on the screen. I can take a direct measurement with the device and compare different areas of the scalp and provide an initial diagnosis. So when something like this happens, I would recommend to find a specialist nearby to get evaluated properly. Okay, so there is a question just came on YouTube. We are on both platforms now, in Instagram and YouTube, going live. A question from Tess. Doc, the top of my hair is thinning too much. Is there a thinning light now? Can see my scalp through. Do you have any tips? So again, this is it's hard to tell. I think the good start would be is to schedule an appointment with someone in your area to get evaluated. Okay, if it happens over time, so if the thinning happens, let's say over last 5-6 years, is likely to be an endogenetic alopecia, and obviously minoxidil, finasteride, I don't know if it's male or female, depends of course on this factor, very important. We can determine what's the best treatment. Okay, other therapies can include SMP. Say before the hair transplant, one of the options we can offer is scalp micropigmentation. It helps a lot to improve visual appearance, and kind of it buys time. You can check online how SMP therapy looks like. And with any questions, yeah, if you're interested, we can offer a virtual consultation. You can contact us, and we can do it definitely. Okay. So next question from one of the forums. People mentioned to use Mama Earth onion shampoo enriched with natural goodness of onion, plant keratin, wheat amino acids, soy amino acids that help control hair fall and promote hair growth. So, so this is exactly what I was talking in the beginning of our podcast. Companies or manufacturers will try to take advantage of people with hair loss because it is devastating for some people. They try to find the best solution. They are very vulnerable because this vulnerability let other people take advantage and sell the products that do not work, do not help hair growth. They waste their time, they waste their money, and there's more, instead of getting advice from qualified, in more harm than good. Okay, I don't find the shampoo, Mama Earth onion shampoo, can hurt, but it can not help. Okay, and I can explain why shampoos generally will not help. Because shampoo, by definition, you use to apply and then rinse it off. Okay, so all these ingredients, if you rinse it off, whatever it is, goodness of onion, plant keratin, vitamin acid. It's very questionable whether they do anything, but you rinse it off anyway. So even if I apply Rogaine, which is proven to help, and I rinse it off right after, it's not going to work. It has to stay on that skin for a controlled period of time in order to be effective. Okay, this is the basic principle behind any topical therapy. If you apply a cream to your skin with some hydration, right, moisturizers, right, and then you rinse it off right away, is this cream gonna work? And you know, no, it's not gonna work because it has to stay on the skin, right? So same. So when you see buy this hair loss defining shampoo, please don't buy it because shampoo will not work. Okay, you will rinse it off after 1 minute. Okay, so next one, 60 years old. Oh, sorry, we have a couple more questions from our YouTube audience. Okay, so can brushing hair too much can cause hair loss or damage? So brush, it depends what type of brush, how many times per day. So generally just a regular brush, you do it gently, should not. Of course, you can see some hair coming off because we can have 10% at any given day of our hair intelligent phase. Sometimes it's 15%. So this hair, when it happens, it will shed. Okay, that's why 100, sometime up to 150 hairs per day that you see in the shower when you're brushing, it could be normal. Sometimes a little bit more, sometimes a little bit less. That's what the cycling of the hair, when it happens, you see that, okay? So when you use some type of very tight, very brush, right? Something that you, as a kids, if somebody get lice, they use this lice removing brush, right? It's very tight. You can probably pull some hair. Of course, if you do it multiple times per day, you can stretch some hair potentially. Very unlikely, but potentially can cause the damage, but usually not, okay? But you just be careful when you try to untangle your hair. So a question from Hadi. Thoughts on patients under 30 years old receiving a hair transplant? Is it suggested? What are potential issues? So it's still under debate whether patients, what age mark we can say, oh, this is safe to do the hair transplant. Most of the doctors around, they say 25 years old, that's the youngest patient I will operate, because we want to see where the hair loss is progressing, how long it's gonna go, how bad it's going to become, what's the worst Norwood scale will happen, and that will help us to determine how many grafts do we need. So I have a different position. I think younger patients, if depends on how devastated they are, if someone is 21, 22 years old and having personal issues and not able to function, not able to study, not able to find a meaningful relationship because of insecurity and depression sometimes, it's there's a lot of emotional issues. So I don't think we should deny that person an ability to improve visual appearance. So it has to be determined by a physician, and it is important, of course, to make sure that that person, if we do someone who is younger than 25 years old, is able and ready to continue with hair loss prevention for the rest of his life. It's important because hair transplant does not negate the need of hair loss prevention. Very important principle. If you go to a doctor and he tells you, oh, I'll do this hair transplant, you don't need to take any medication, please run away. That person should not be practicing hair restoration. because hair loss is it's a chronic condition. It will never stop. We're talking about hair loss due to androgenetic. Okay, I need to make a correction. Okay, so the most common male or pattern female hair loss will always get worse unless you try to take to control. And we have options how to do it. But again, it's case by case. We can decide whether a younger patient is a good candidate, and especially the most important factor, if I can see as a doctor that he or she, most commonly it's he, is able to continue with the therapy, daily therapy to prevent hair loss. Okay, next question from Anna. Can I have dye my hair while using laser therapy, laser cap? So yes, yeah. So as I mentioned before, laser therapy is very good in preventative to take preventative measures against hair loss. Laser therapy provides a certain low level laser stimulation of the scalp. It increases blood circulation. It helps with other causes of the hair loss, helps to control DHT levels, and it's been evaluated by FDA to be effective in preventive hair loss. You can dye your hair. I don't think the laser is at that level that can affect the dyes in the hair, right, or the hair color. So I would say yes. Okay, so next question. All right, so for men, 60 years old, losing his hair for past 2 years because of COVID and weight loss. What are best options? Okay, good question. So when we talk about hair loss related to COVID, this is type of hair loss defined as most likely telogen effluvium, okay, and depends on the type of the disease. In this case scenario is COVID, and some people had very severe infection with COVID, and of course the more stress on our body is exerted, the more hair loss or telogen effluvium we can experience. So it definitely needs to be evaluated. Medications such as minoxidil, treatments such as PRP, Regenera, low laser level therapy can definitely help with symptoms over time. Removal of the stress is ultimately the goal, right? So once the recovery happens, that's good, and everything starts improving over time. Okay, so that's some of the options. And a weight loss. So I'm not sure if the weight loss question was related to using one of these newest therapies such as Ozempic, Mounjaro, and others. Okay, so it's sort of in the emerging market right now, and it becomes pretty evident that one of the side effects is actually hair loss. No one is actually sure 100% why. There are some theories behind it that again I'm not going to discuss it because it's. But we do know that there is likely correlation. So I think my personal approach to people who starts with weight loss therapy is to seek for someone qualified to evaluate the hair, okay? To take the snapshots of the trichoscopy, as I mentioned before, something like this. Most of dermatology offices will have. And when you ask trichoscopy, they will know what you're talking about. Taking the images with 50 times magnification from the scalp area. And and then see what happens. Okay. I usually tell my patients, okay, if you're going to start Ozempic, let's do the snapshots of different areas. Okay, let's recheck them in 1 month and see if there is anything, any changes, and then we can react. Okay, I think PRP can definitely have a good, it's a good option to prevent telogenous effluvium. I frequently recommend it to women, even before they start the lactation, right after to do a PRP right after the birth to have the most protection to the hair follicles against telogenous effluvium. And minoxidil is another option. I would start it actually preventatively before you start the medication for weight loss. Okay, hope it answers. Okay, another question from one of our viewers. Tess, what's your opinion on hair system? So when you ask about hair system, you probably refer some artificial hair that been applied, right? If it's correct. Okay, so I know it's for some people it's the only solution. It either there's not enough donor hair to have a hair transplant, or it's not financially possible. So it could be a resort. They can be resorted to use a hair system, a toupee, right? And different. And there are different manufacturers. They use natural hair. It could be glued. It could be applied to the hair with using small hooks. Okay, so it's not there's nothing really straightforward here. So I can tell you that hair system that applied with those hooks can actually cause some tractional alopecia by pulling the hairs in the surrounding area constantly and causing more hair loss, right? Some hair system can create tightness of the scalp and reducing the blood flow to those areas. Same thing. So when you decide whether the hair system is a good option, it's important to research how it's being glued, how it's being adjusted, and yes, exactly, that's the approach. So next question: can hair extension can cause hair loss? Well, I know that barbershops or hair salons will not like the answer, but when I ask this question, I have to answer as a medical doctor, okay? They will. So hair extension will absolutely cause hair loss and will make it much worse than it was before, because they are attached to already failing hair follicles and pulling on them 24 hours a day, creating what they call tractional alopecia. Tractional alopecia is irreversible and will get worse unless you remove the factor. So I will, as a hair transplant physician, I will recommend not to do hair extensions if you're looking to improve your look, because you'll over time you'll need more and more of them, and the more they do it, the less of your real hair will be growing. Okay, and I know the owners of the hair, because it's a huge business. They do a lot of it, but again, I cannot be affiliated with anybody. I have to give a truthful answer based on my medical knowledge. Okay, here's a question from our Instagram follower. I do hair transplantation in Turkey. I have knowledge of all methods. I have been doing canal and DHI cases in this sector for 8 years. Well, very good. So there's a lot of different methods. Well, it's actually not a little different methods. Let's talk about what are the options. So when you call I always read DHI. So DHI stands for direct hair implantation. Okay, so DHI, it's not a separate method, but it's actually, sorry, I have to take, can you answer it? So, outside. So, sorry, I'm a physician, so there is still things going on in the office, and I have to answer. So, yeah, it's life, and I'm in the office. So, DHI method was, sort of abbreviation, was created to describe placing grafts using sharp implanters. And sharp implanters, they look like that. Okay, this is the sharp implanter. We frequently use it. We frequently use it in our cases. I do, as a hair transplant physician, I do every case myself. And this is the method I use to place them. I have an ARTAS robot that does also sharp implantation, which is very similar to that. So I can use either robotic or manual implantation. So the proper name of this is not DHI, because DHI is something that just defined, I don't know if defined, but I think there is a company that's called DHI. But these implanters were actually created back in early 90s in Taiwan. Okay, the first doctor who created them, his name is Dr. Choi. So he came with the concept of using needle-like device to place hair follicle. Okay, and so the proper name to use, and this is the name that been adopted by International Society of Hair Restoration Surgery. That's the only body kind of that governs, and it's a collegiate of different surgeons from all around the world. The correct method is a sharp implanters, and yes, it's one of the ways to place hair follicle. I think that's one of the best ways. I like that. You know, I'm able to achieve much higher speeds, between 12 to 1300 grafts per hour, which definitely helps with how fast the procedure moves. And ultimately, the faster you can get these grafts placed into the scalp, right, the better they do. So I hope that answered the questions. Okay, next one. What other beauty procedures besides extension can produce future problems for hair health? Oh, a lot. Okay, so a lot of procedures that African American ladies use can result in problems with hair loss, right? Straightening products, braiding, very common, seen in both genders now. Sorry, I have to be politically correct. In multiple genders, and those the braiding can result in traction alopecia and a worsening of the hair loss, of course. Okay, straightening products used with African American patients can damage the hair chemically and result in hair loss. High temperature application can cause burns, resulting in scarring alopecia. Okay, burn is not good. It pretty much destroys everything under the skin and should be avoided. So all these practices I think should be applied very carefully, or probably not at all. Other treatments such as they call the hair botox, keratin, will damage the hair shaft, will make it more fragile, dry, and will result in fragility of the hair shafts, and and the visual appearance not too what we like to see. Okay, so next question. Hi, Dr. Max. I was in your preceptorship February 1 to 3, and your team were awesome. Oh, thank you. Thank you for joining the live session. Absolutely, that's something that we do. You know, we do live surgery preceptorship here. Last time we had it just recently in February. We had 12 people doing surgery, postoperative management of patient, and I like to share as much as I know with other doctors. It helps. I think it helps everybody. I hope it was informative, and thank you for your comment. And yes, couple doctors actually coming back to have a surgery. Actually, one doctor came 3 days after and had a surgery with me. So he was during the preceptorship, decided he wants to have his surgery. Came 3 days later. We did the hair restoration. I think he's pretty happy. Went back to Canada. Okay. Next question. How does my, sorry, I just turned 50, so I don't have my glasses. I have to do a little exercise with my eyes to read in a tiny screen. How does microneedling work for hair growth? Oh, great question. So what is microneedling? Microneedling is, by the way, what about the time? Are we?
It's enough for internet.
Yeah, okay. So remember I mentioned PRP. So PRP works by bringing growth factors through concentrated platelets injected into the skin, under the skin, I'm sorry, around the hair follicle. You can do facial treatments, you can do joint injections in sports medicine. So PRP is widely used. And how PRP the concept was developed, because someone noticed, okay, if we get bruise, how do we heal? Okay, the body will recruit a lot of platelets. There are it's a little bit more complicated process, the chemotaxis and others, they may recruit to this area, and they start to release growth factors. And this is how the healing occurs over time. Okay, and then they decide, okay, instead of actually causing an injury to this area, let's try to draw the blood, concentrate platelets, and inject it directly the growth factors, so we don't have to create an injury. And this is how the entire field of PRP was developed. And so microneedling is the opposite. So we create a small injury to attract those platelets towards the site of the injury, and at the same time these platelets will start to release growth factors, and the same thing happens. So microneedling definitely has some potency. However, you have to be very careful. If you do it by yourself, you don't know how deep this needle goes. If they go too deep, they can damage hair follicles, they can damage other structures, sebaceous glands. I don't know how big is this needle, so there's no really a standard of microneedling. So instead of doing good, you can do harm. Okay, so we need to know who is the manufacturer of the microneedling device, what data they have, how safe is the device. So there's a lot of questions there before you can trust that thing. So I would suggest, if you value your health and health of your hair, rather do it in somewhere qualified place that you can trust, that they know what they're doing. Okay, very important. And you will not have problems because I've heard people get hurt with some of these microneedling devices that have been sold at Amazon. All right. Okay, so let me see. What is the next question? For men taking finasteride. Okay, a man taking finasteride, discuss potential side effects such as erectile dysfunction, etc. So, finasteride or Propecia is FDA cleared for treatment of hair loss in men only. This is the official designation by FDA, and that's the only medication, prescription medication, designated by FDA for treatment of hair loss. Okay, so if you any medication that you buy, you will read all potential side effects. So finasteride has this notorious side effect listed when you get the Propecia, that there's a chance of problems with libido, with erectile dysfunction, and so on. So how side effects are reported? So when medication undergoes through those double-blinded, randomized studies before it's been released to the public, they will collect all the data. So people who take medication, and researchers will know which one, they will report everything what happens to them. So a certain percentage, a small percent, less than 2%, I believe, but again, it might be, the data constantly changes, reported that they had some problems with libido, with erectile dysfunction, and definitely, people should be warned about it. Okay. Other side effects that are relevant, there could be decrease in sperm count. So finasteride, then being taken by men, can lower the sperm count. So if it's reversible, once they stop taking, it returns to a normal level, but it has to be taken into account if they're trying to have to conceive baby, a family, right? It's you don't want to lower your sperm count. Again, most of the time, and I would say 98% more, it is safe to take the medication. There's no reported side effects. Throughout my practice, maybe 1 or 2 patients had something like this, and it was reversible. Recently, we have options to, instead of taking the pill of finasteride, is to apply it topically. Again, this is what they call off-label medication, right? But the same finasteride, and at least pharmacologically thinking, the bioavailability, that's a pharmacology term when you're taking medication, what is actually available in the serum with taking the topical solution is much less. Okay, so patients who are more concerned about the side effects, there's an option to use medications topically, such as finasteride. Okay, so this is most common. Okay, so I hope it was informative. The idea here is to continue doing these live sessions, try to answer questions, and I think it would be very important, specifically when we have so many opinions and not necessarily based on the real knowledge being offered online is an advice. Okay, so always double check. Don't trust people that write to you as a response on these forums. Ask more from qualified professionals, and there's a lot of good doctors around. Okay, you can search, and we'll see you then. Thank you for being with us today. Please join us during next live stream. Please subscribe so you can get notified about the next streams that we will offer. It was great. See everybody today. Okay, it was Dr. Max.